With the inference from that only, I started treating hypertension. And one more thing I observed, when I used to get good results with hypertension, I have tried few cases in the initial stages with lower potencies. But I didn't get that because the cases that I already presented for around 8-10 years, my experience, right? More than that. Okay. So I have tried in few cases, starting with the lower potencies, 200, like that, but that was not responding at all. Otherwise, it is taking a lot of time to respond. But as I shown the cases and I will tell you one thing: all these hypothyroid cases, I am not purely on homeopathic medicine. Purely, I didn't give any other medicine in here. I mean, homeopathic medicine, nothing. Sorry, I mean allopathic medicine. I don't know nothing. It is purely on homeopathic medicines. Okay. So I have got good results. So when I tried with lower potency, either it was taking it some time. Okay. Otherwise, there was not getting response. So nowadays I use only hypothesis. That's the reason.
Sir, but in your cases, the TSH level is decreasing. Still, you raise the potency from 10 m to 50 m. What is the reason for that?
Hey, that I see in cases. For example, so you can see it's up to the level of 5, right? So based on that, I repeat or raise the potency. Okay, it will be in the range of borderline. For example, as far as pregnancy is concerned, in pregnant ladies, the level should be below 3. When the normal level is 5, 5.2, in pregnant ladies, if you go to any gynecologist, they do, and if your level is 4 or 4.5, they start with around. Okay. And I was just explaining in between. So if it is in the borderline, I raise the potency. And as I told, the patient is stable for 1 year, 1.5 years. I tell them to stop the medicine and repeat the test within once in a 6 months. Okay. And later on, if any symptom is there or if any investigations, the device, so I repeat the medicine.
So, do you have any experience of treating thyroid cases with homeopathic medicine that the treatment is completed and you stop the medicine? The patient had a level within normal limits, but after few years, maybe after 3
Yes.
or 6, came again.
Yes. There are few cases. The last case I discussed, okay, the 3-year-old female I told you, she was just left the treatment around 1.5 years, and last time she came at level of 7. Because again, anti-TPA positive. So one thing I observed, in anti-TPA positive cases, the response is bit difficult comparing to anti-TPA. So it is very easy to treat, relatively easy.
Thank you, sir. Thank you, sir.
Any other?
सर जनरल क्वेश्चन है जो सभी होम्योपैथों के लिए है कि वैसे तो अपने अपने क्षेत्रों में सब अपना अपना ट्रीटमेंट अच्छे इनक्यूरेबल केसेस को करते हैं, लेकिन मेरा सवाल ये है कि अगर एक पेशेंट कोई भी आया और 10 होम्योपैथ यदि उसको सिलेक्शन मेडिसिन करेंगे तो भिन्न भिन्न होगा, तो ऐसी कोई टेक्निक निकाली जाए कि सेम केस आए और जितने होम्योपैथ आए तो सेम मेडिसिन आए, क्या ऐसा हो सकता है या नहीं?
I think it is possible. I think it is. I have already told. I have given the answer in my presentation itself. Homeopathy is not a black magic. Don't make it a black magic. Okay. So otherwise, see, basically, if you are following standard textbooks, if you are reading Materia Medica, if you are using cancer property, there will be not much difference. Even I observed when actually we are very close friends also. So when we prescribe, there will be when Dr. Solly is sitting here, so he is also a medical officer. When we prescribe, I have not seen much difference. Much difference. So basically, if you are prescribing based on standard Materia Medica and repertory, there is no scope of much change, I think. That is enough. If you want a standardization, So everybody should follow the standard textbook. Then obviously there will be no such a change.
Good afternoon, sir. Sir, I have a question. Sir, the patients usually come with already done prescriptions for hypothyroidism, like they are on Thyronol. So, sir, what should we do? Should we ask them to stop the medicine when we give them homeopathic medicine, or what should be the protocol?
One case I told. The patient was around 2 years, he was on Thyronol, 50 mcg. I stopped it gradually. But in that case, it was successful, but I have bad experience also. I generally don't stop immediately because the patient is on replacement therapy for 2 years, 3 years, or more than that. Okay. So I generally ask patient to stop it gradually. But there are experiences when gradually we are tapering, the patient will have symptoms and the patient will not be able to manage without medicines, allopathic medicines. So most of the cases that I have treated is fresh cases that came I diagnosed and without any treatment of hormone replacement therapy. Okay, the patient was already on hormone replacement therapy. It is bit difficult, provided the patient is very cooperative. So because symptoms may be because of anxiety also. The patient will have a psychological feeling. I have stopped the medicine, right? So that may be reason. I have seen one patient, she has become very restless. But when I repeat the test, the result was almost in same range only. There was no much, increase in the TSH level, but she was showing very anxiety and type of features. So maybe because psychological factors also may be playing. So what I observed is, generally, when I was discussing with Dr. Bodhi yesterday, we were discussing in a situation. In new cases, because I have treated many cases of rheumatoid arthritis also, already on treatment, okay, with steroids and other medicines, that is very difficult to respond. But the case that I treated was a fresh case, the patient is still fine. Okay, when I am in touch with the patient, she is coming to me with some other issues and all. So her rheumatic issues, symptomatologically, she is better. Okay, so you can start, but should be done very carefully. Okay, don't stop immediately. There will be patients who are taking 100 mcg and all. If you stop immediately, it will create problem. So generally, what I start the medicine. Okay, after 2 to 3 weeks, I used to advise the patient to reduce it gradually and see if it is working better. Otherwise, I generally tell them to continue medicine itself. Okay, allopathic medicine. Because our aim is to help the patient to cure, not to prove something. I believe that the patient, even I am not able to help him, the patient is getting help, so I let them continue that best.
You mentioned in your lecture that in the management of autoimmune diseases, we should supplement with vitamin D. So if the level is within normal range, then also we should supplement.
What I try to explain that this is the method they are in modern society they are practicing for 2-3 things. For this, especially for the use of this vitamin D supplement, there is proved effective. There are many researchers that if you are taking proper, you maintaining vitamin D, that will reduce the severity of the autoimmune disease. What I suggest, we can also use that. Actually, for treating autoimmune disease, you have to check the vitamin D. Number 2, actually, by seeing many cases, actually, I present only case of this Crohn's disease. Many cases are treated. Even for celiac disease case, 2-3 cases I am treating even now with me. But the problem with me, I am not keeping any records of the case. Actually, simply keeping the records of the patient, so that I don't have any that much record. But my point in that case also, if you are following that the exciting factors, you can prevent that, and we will get a easy result. We give the proper diet and regime. You should give importance to diet and regime. Definitely, that will help to give a better result and speedy result. That's the only thing I suggest.
Any other query do we have right now? Please.
Sir, my question to Bodhi sir. Sir, you prescribed cifalinum and tuberculinum in your case. Sir, what were the symptoms?
There's no time to explain the reason. Actually, there was a cheat to stop your presentation. But that's the only reason I did not explain the real symptom being. That's it, please say. The child was 14 years. Actually, symptom is selected. That's very, almost all symptoms are nightly aggravated, very particular. He can't sleep alone at that time. He wants to sleep with the mother and his father throughout the treat at that time. And the discharge was very offensive and very painful discharge, and also was non-healing. And he was so desperate. I consulted him through only at that time through chat only. He was so desperate. He got no belief. He has no belief he can't survive. He will die. And the symptoms of almost syphilitic symptoms, you will get almost all the symptoms. And that based on the totality of symptom, I take the case and totally based on total symptom, I prescribe 50 m. Actually, the symptom, again the first symptom, I prescribe starting 50 m. Actually, if you read the boric material, again very clear, you can use only very high potency of cifalinum. And in infrequent dose, I repeat the dose in after 3 months. After the 3 months, and the other thing, the important symptom, I treated with him to use regular cyst bath twice. I asked the patient, actually there is perineal ulcer, lots of perineal fistula, all are discharging painful blood and pus. And I asked the patient to do cyst bath twice daily. And one thing I try to mention is that one tincture I used, I said during the course of treatment, one time suddenly he developed severe pain and the discharge again was very severe and painful discharge and severe abdominal pain. At that time I prescribed myristica tincture. I asked him to take myristica tincture 5 drops daily for 1 week. That helps. And another medicine after 2 months again I took the case again and the symptom changed, and then I prescribed this tuberculinum. And last again I repeated tuberculinum twice or thrice. And last prescription, actually even now he's in contact. Last time I prescribed carbovich. From starting from I think syphilitic, then mix of tubercular, then almost carbovich actually compared almost all 3 miasm symptom. Actually, that's what I lately observed. The medicine which covered the last carbo is having 3 equally predominant 3 miasm. Starting from that syphilitic to then tubercular miasm, then syphilis and sora, and all with last. Now he is controlled by the carbovich, and there is no such symptom. If even some symptom, then simple, so sometimes have some cold or cough, that's only simple. He's perfectly okay. Now his weight is 71. And last slide, there was a slide from his comment from his father. Now he's studying his 12th standard and he got good marks in 11th standard. He got 92% marks. He was very happy. And child is very happy. I talk to him regularly. And the prescription cifalinum is based totally on the totalism. There is no magic. The symptom covers almost all the syphilitic features, and the symptom is spent. After repetization comes to cifalinum, that's the only reason I prescribe that. That's it. Thank you.
Any other query? So that's a very good interactive session, because I believe that every academic session or scientific session should be two-way. So we are having very good two-way communication here. Thank you sir, thank you speakers.
सर आपने क्रोन्स डिजीज और हाइड्रोडेंटिटिस सुपरटिवा के एसोसिएशन के बारे में बताया था, व्हाई, और ये इसकी स्किन मैनिफेस्टेशन है या अपने आप में ऑटोइम्यून डिजीज है?
As skin manifestation actually is an observation. Actually in the study of Crohn's disease, even in pathologic textbook we can find that in most of the Crohn's disease there is a high probability of this hidden separator for those who are having Crohn's disease. So my suggestion, if some patient comes to you for us for treatment hidden separator, we have to rule out now the criteria for how to diagnose the case of Crohn's disease. There is no such test, simple test. You have to ask the patient for CRP, ESR and the stool test, and if it is positive, then you ask them for a simple antinuclear antibody. That helps. Actually, Crohn's disease earlier time nobody was accepted. Especially in third world countries, someone is presented with the symptoms of Crohn's disease, they simply stamps as tuberculosis. most of the symptom is very much similar to tuberculosis. So someone comes to the symptom, usual way of prescription by the doctor, especially allopathic doctor, they start this as tuberculosis, and they simply starting ATT. Due to some or the other reason, some symptomatic relief they may get, but they are ignoring the proper diagnosis. There is a point what I try to emphasize that hydrogen sulfurate is more common in patient having Crohn's disease. Someone comes to us for treatment with hydrogen sulfurate, we have to also, there is an opportunity to rule out there is a chance of Crohn's disease or not. That's what it is.
Sir, there isn't any symptom sequence between both of them?
No, there is no symptom sequence, but this is observed fact. This is observed fact that hydrogen sulfurate is more common in patients having this Crohn's disease. Actually, one thing I want to try to explain, most of the autoimmune diseases have some similarity. One case, I am sorry to say, actually I don't have the proper record with me. One celiac disease case with me. A mother comes for treatment of celiac disease. I diagnosed the child with celiac disease because the child developed disease only 5-6 years balanitis, recurrent infection of the external genitalia. But after there's maybe a manifestation of celiac disease, I asked them for the proper investigation, and it's proved that celiac disease. The most interesting thing, his sister, she is having SLE. Her father, he's a cancer patient. If you study in proper the autoimmune disease, the manifestation between this autoimmune disease and the cancer manifestation and other autoimmune disease are almost same. There is some association. There is no pure theory. Actually, that's why I am trying to explain that our theory of miasm is very. We can read in between. Actually, we can. If you study properly our miasm theory, then we can treat most of these autoimmune diseases. That's Dr. Anil also explained that a person come to directly without taking any allopathic medicine, we have a good chance. But one more thing I want to confirm that you have to definitely, my request, you have to do for proper lab investigation. Then only we can assess the progress of the disease. With symptomatically, definitely we can give proper relief to the patient. But for confirmation and for other reasons, we have definitely go for lab investigation, and we have to compare the values. That also helps. That's a very important case. Actually, there is strong association between the SLE, this cancer condition, and this other autoimmune disease. So whenever a patient comes to for one condition, we have to taking a proper family history. We can assess the proper development and the progress of the disease to that particular patient.
Sir, the last one. आपके केस में HS का आउटकम क्या रहा? Hydradenitis suppurativa, तो उसका क्या आउटकम रहा?
I treated even now I have 2-3 cases. Good response, no doubt, good response.
Is it curable?
Curable cases, no doubt. I have 2-3 cases I cured, 2-3 cases I have. Now I have one case. He is a person working with Airport Authority of India. He is now with, actually for the last 6-7 months he is taking my medicine. Otherwise, every second week he has to go for some drainage. Actually, both axillas and in his perineal area he is having lesions. Now even now he is having the problem, but it's the duration only once in 3 months or 6 months. Actually, now the case is improving, and I have 2-3 treated cases cured. I have. Good.
One thing is confirmed that we have very good listeners today. Thank you all. And but we have a time limitation also, so I request Pankaj sir or Kirti sir, please conclude the session. Thank you.
तो आज तो RHS ने जो प्रोग्राम ऑर्गेनाइज किया उसको कहना चाहिए कि मौका भी है, दस्तूर भी है। टॉपिक इतना अच्छा रखा जो आज के टाइम का सबसे इन टॉपिक है। हम सभी जो क्लिनिक में प्रैक्टिस कर रहे हैं, हार्डली किसी का क्लिनिक होगा जहां पे ऑटोइम्यून डिजीज का केस नहीं आ रहा। और आज जो RHS ने स्पीकर्स को बुलाया, आई मस्ट कॉन्ग्रेचुलेट के डॉक्टर अमर बोधी एंड डॉक्टर अनिल, इन्होंने जो प्रेजेंटेशन दिया है, मेरे लिए तो ये इतना लर्निंग प्रेजेंटेशन रहा दोनों का कि एक तरफ डॉक्टर बोधी ने बहुत अच्छा डिटेल्ड एक जो हमारे को कंसेप्चुअल पार्ट चाहिए किसी पर्टिकुलर डिजीज के ग्रुप को समझने के लिए उसको बहुत अच्छे ढंग से समझाया। और उस एकेडमिक साइड से, मतलब अगर देखें तो बोथ आर डॉक्टर्स एंड क्लिनिशियंस, बट एक का एकेडमिक साइड ज़्यादा है बीइंग इन कॉलेज एंड एक का क्लिनिकल साइड ज़्यादा है बीइंग इन द मेडिकल डिस्पेंसरी। तो एकेडमिक साइड की बातों के अंदर कुछ पॉइंट्स मैं जो ऐड करना चाहता हूँ वो ये है कि जैसे भी बात चल रही थी, क्वेश्चन भी था और विटामिन डी के बारे में। एक किताब है नॉर्मन क्विजन की एनाटॉमी ऑफ इलनेस, उसमें वो ये बताते हैं कि इस टाइप की इनक्यूरेबल डिजीजेस, ग्रुप ऑफ ऑटोइम्यून डिजीजेस, उसमें उन्होंने देखा कि हमको जब कुछ भी समझ में नहीं आ रहा ट्रीटमेंट के लिए, तो हमने क्या किया कि सिर्फ विटामिन डी इन्फ्यूज करना शुरू कर दिया या विटामिन सी देना शुरू कर दिया और पेशेंट्स ठीक हुए। मैं यहाँ पे आपको एक बात रिमाइंड कराना चाहूंगा अफोरिज्म 76 की, जहां पर हैनमैन कहता है लेट वाइटल फोर्स रेमेडाइड इटसेल्फ। कई बार ये चीजें, इस तरह के सब्सटेंसेस, सप्लीमेंट्स, बहुत सारे अनड्यू मेडिकेशन को रोक देता है, जो कि लाइफ की एनर्जी को एक सफिशिएंट टाइम देता है कि किस तरह से रिकवर कर लिया जाए। और इसी तरह से अगर आप इम्यूनिटी के बारे में समझें तो मॉडर्न इम्यूनिटी के जो फाउंडर्स रहे उनमें एक थे डॉक्टर वॉन बेहरिंग, जर्मनी के, जिन्होंने अर्ली स्टेज में, अगर हम एलोपैथिक साइड की बात करते तो इस इम्यूनोलॉजिकल एस्पेक्ट में काम करना शुरू किया था। कब किया था? उनका जो एरा था वो करीबन 1854 से 1917 का था, वे आफ्टर हैनमैन लेफ्ट दिस अर्थ, 1755 टू 1842। अब आप समझिए कि जो बात ऑटो इम्यून डिजीज या उसके जैसी बहुत सारी बीमारियों को ट्रीट करने के लिए हैनमैन ने वन साइडेड डिजीजेस कह करके स्पेशल इंस्ट्रक्शंस के साथ छोड़ दिया, समझा करके अपने क्लिनिकल एक्सपीरियंस के बाद, उस क्लिनिकल साइड को बहुत अच्छे ढंग से उन्होंने एलॉबरेट किया, जिसका कि आज हमें बहुत सारा लेबोरेटरी एस्पेक्ट मिल जाता है जो हमें डॉक्टर बोधी से सीखने को मिला आज। तो ये एक बहुत इंपॉर्टेंट एस्पेक्ट है कि हम 186 से 204 के जो अफोरिज्म्स हैं वन साइडेड डिजीजेस के, अगर सही मायनों में हम अगर ऑटोइम्यून ट्रीट करना चाहते हैं तो इन एरियाज को हम बिल्कुल ना छोड़ें, ये सबसे इंपॉर्टेंट एरिया है। और वॉन बेहरिंग एक बात कहा करते थे कि अगर मैं मॉडर्न इम्यूनिटी की बात करूंगा तो मुझे उसको होम्योपैथी के रेफरेंस के बगैर मैं उसको बात नहीं कर सकता हूं, उसको बोल नहीं सकता हूं। इतने गहराई से वो लोग होम्योपैथी की बात को समझा करते थे। फिर दूसरी बात कि अगर हम थोड़ा सा आज अगर देखें लेटेस्ट टाइम के अंदर, अगर सबसे ज्यादा इम्यूनिटी पे काम किया तो एक डिसिप्लिन डेवलप हो चुका है, दैट इज कॉल्ड साइको न्यूरो इम्यूनोलॉजी। एक बुक है 5 वॉल्यूम्स के अंदर, डॉक्टर रॉबर्ट एडर, वो साइको न्यूरो इम्यूनोलॉजी उसका टाइटल है, बाय रॉबर्ट एडर। काफी कॉस्टली बुक है, बट ये जो नेशनल मेडिकल लाइब्रेरी है ऑल इंडिया इंस्टीट्यूट के बराबर में वहां अवेलेबल है। क्योंकि मैंने इस पे अपना पीएचडी पे काम किया तो यहां से हमको इतनी अच्छी बातें सीखने को मिलती हैं कि जब हम ये कहते हैं कि माइंड से बॉडी में बीमारी कैसे हो सकती है, इन्होंने उसको लेबोरेटरी में प्रॉपर ट्रैकिंग करके दिखा दिया कि ऐसा होता है। तो मैं बोलूंगा कि आप बहुत अच्छे ढंग से साइको न्यूरो इम्यूनोलॉजी के बारे में बहुत अच्छे ढंग से देखें, वॉन बेहरिंग को अच्छे से पढ़ें, नॉर्मन क्विजन को देखें। अब बात करते हैं कि हमारे को क्या बहुत अच्छी बातें डॉक्टर अनिल नायर से सीखने को मिली। शुरू में हमको ऐसा लगता है कि अरे भाई क्या 15-20 केस डाल दिया, बता दिया, इसको सल्फर दे दिया, इसको ये दे दिया, इसको ये दे दिया, लेकिन बहुत ही सटल वे में, बहुत ही सुंदर तरीके से इन्होंने एक बात बताई कि मैं एक बिजी क्लिनिक में काम करता हूं, गवर्नमेंट की डिस्पेंसरी में काम करता हूं, बहुत सारे लोग हैं वहां पर। क्या तरीका है इनका? जो हैनिमैन का अफोरिज्म 153 का तरीका है, ऐसा सिम्टम पूछो जो क्या हो, अवे द डिजीज, अवे द डिजीज। मैं PQRS की बात नहीं कर रहा हूं, ये रॉन्ग फ्रेज यूज किया जाता है। 153 कहता है मोर स्ट्राइकिंग, अनकॉमन, पिक्यूलियर, ये वर्ड कहे हैं। क्यों? मोर स्ट्राइकिंग ज्यादा इंपॉर्टेंट है। तो इन्होंने क्या लिया? इन्होंने अवध डिजीज लिया। भाई तुमको खाने में क्या पसंद है? डिजायर, अवर्जन्स, थर्मल रिएक्शंस, ऐसे एरियाज के सिम्टम को छांटा इन्होंने, जिसपे बहुत जल्दी से प्रिस्क्रिप्शन निकल के आता है। और अवध डिजीज है, यही तो हम लोग सीखते हैं। और उनको केसेस में रिजल्ट मिला है। उन्होंने पूरी जो बात यहां टाइटल में लिखी हुई है, ऑटोइम्यून डिजीज एविडेंस बेस्ड, प्रॉपर एविडेंस के साथ हमको फोटोग्राफ दिख रहा है। अगर विटलिगो की बात है तो ठीक हो रहा है कि नहीं हो रहा, हमको पूछने की जरूरत नहीं है। हाथ कंगन को आरसी क्या। आप देखिए कि यहां जो एक दूसरी बात बहुत अच्छी मुझे सीखने को मिली, मेरे लिए टेक होम है केसेस से डॉक्टर अनिल नायर के, पोटेंसी। मेरा एक्सपीरियंस ये रहा कि बहुत सारी जगह पे अगर मेरी मेडिसिन सही भी है तो मैं फेल करता हूं पोटेंसी की वजह से। बहुत बार मैंने ऐसा सेमिनार में सुना, बहुत से लोग बहुत कैजुअल लेते हैं पोटेंसी को। मेरा समझना, मेरा एक्सपीरियंस, मेरा क्लिनिक में फेलियर ने मेरे को यह सिखाया कि जितना केयरफुल आपको सिलेक्शन ऑफ द रेमेडी के ऊपर होना है, उतना ही केयरफुल आपको पोटेंसी के लिए होना है। इसके बाद तीसरा एक एस्पेक्ट है प्रिस्क्राइबिंग में कि आप कितना क्वांटिटी देंगे एक बार में और उसको कितना रिपीट करेंगे, एक बहुत इंपॉर्टेंट एरिया है। डॉक्टर नायर के केसेस में उन्होंने मोस्टली एक डोज दिया, जहां जरूरत हुआ वहां रिपीट किया। जो केसेस डॉक्टर अमर बोधी ने बताया वहां पर भी कुछ इनफ्रीक्वेंट डोजेस, मतलब पूरे के पूरे क्लिनिकल केसेस दोनों ही लर्नड स्पीकर्स के अगर मैं देखूं तो हमें एक बात निकलती है कि हाई पोटेंसी इनफ्रीक्वेंट डोजेस, ये एक बहुत इंपॉर्टेंट रूल हो सकता है जो हमको अपने ऑटो इम्यून के केसेस में फॉलो करने की कोशिश करनी चाहिए। तो मैं समझता हूं कि आज का दिन जो वर्ल्ड हेल्थ डे भी है, और अब एक दो दिन के अंदर ही हैनिमैन बर्थडे आ रहा है। मेरे ख्याल से दुनिया में पिछले 250 सालों से भी ज्यादा हम देखते हैं कि एक ऐसा डॉक्टर है, डॉक्टर हैनिमैन, जिसका पूरी दुनिया में किसी ना किसी तरीके से बर्थडे सेलिब्रेशन होता है। आज का ये दिन, आज का ये सेमिनार, आज का ये सेशन हैनिमैन को सबसे अच्छा डेडिकेशन है। थैंक यू वेरी मच एंड standing ovation and round of applause for both the speakers. Thank you. Standing ovations please for him. Thank you everyone. Thank you so much.
I extend my gratitude to the speakers and chairpersons for this phenomenal session.